Thanks for the invitation to speak to you this evening, and thanks for turning out on a lovely autumn evening. So my name's Helen Carton. I'm one of the vets from Scotland's Rural College, and I've worked in mixed practice for 4 years when I first qualified. And following on from that, I joined the Scottish Agricultural College at our site at Auchencruive in Ayrshire back in 2007, so longer ago than I'd like to admit. And so for the past 18 years, I've worked in farm animal disease surveillance. And so that means that we're supporting vets working in practice in investigating disease outbreaks. So Celia asked me if I wouldn't mind covering the funding that is available through the Preparing for Sustainable Farming grants, and a particular focus on how that funding can be used to test for parasites, to see whether treatment for parasites is necessary or not. So, the Preparing for Sustainable Farming funding has been available for carbon audits and for soil sampling. And for the last 2 years, and this is now the third year, funding has been available for animal health and welfare interventions. So if you're not aware, there's a page on the Scottish Government website under Rural Payments and Services that's got lots of detail about this funding and how to tap into it. But hopefully we'll cover most of the common questions tonight. So why is funding available? Well, Scotland aims to become a global leader in sustainable and regenerative agriculture, and they Scottish Government recognise that improved animal health results in better production efficiency and improved welfare, allowing us to decrease our greenhouse gas emissions per kilo of output. And really the aim is to encourage less engaged keepers to start doing best practice disease prevention activities, or, and this will probably be the case for many of you, to reward those who are already following really good practice. So the funding is there whether this is something that's been part of your routine or not. If it's not been part of your routine, it's a wee incentive to let you think about whether this funding would be right for you. But there are lots of different options, as we'll go through, not just related to parasites. So the hope is that there's really something for everybody if you're keeping cattle and sheep. So what is in it for you? Well, there's up to £750 available this year for testing. And really the animal health and welfare interventions are an opportunity for you to review your current practices with your vet or with your advisor, to look at what current issues you might be having, to think about what risks your flock or your herd might face in the future, how to mitigate any of these future threats. And it's a really good way to sort of use this funding to feed into your herd or flock health plan. So there are 9 options to choose from. And some of them, if you've got cattle or sheep, there are options that are available to you. But the cattle options are on the top of this list here. So there is the possibility to draw down funding to look further into bull fertility or calf respiratory disease. And then the next 2 are the ones that we'll talk about more this evening. There's options to draw down funding for investigation of liver fluke or roundworm investigations. On the sheep side of things, sheep scab investigations qualify. Investigation of iceberg diseases qualifies. If you wanted to look at lameness in your flock, you could draw down funding for that. And then similar to the cattle, liver fluke and roundworm investigations would qualify as suitable animal health and welfare interventions. So as a farmer, as a crofter, you can claim £250 per intervention, and you're allowed to do 2 interventions per year. And if you've not claimed before, so if you didn't claim in 2023 or in 2024, then on your first claim, you can claim an additional £250 along with that first claim, and that's to support learning and development. So if you've never claimed through PSF before on the animal health and welfare interventions, there's £750 up for grabs. If you have done it before, then you're allowed to claim for the same interventions, because although you're repeating similar testing, the point usually is that the picture could have changed this year, so that's why it's important to keep these interventions up. So it's a standard payment regardless of the size of the herd or the flock. Investigations and actions need to be completed by the end of the calendar year, so by the end of December, and your claim forms must be in by the 28th of February of next year. So you've still got 3 months to work through and consider what interventions might be appropriate for your herd or your flock. And then once you've completed them, discussed what advice you're going to take on board from your vet or your consultant, you've got a further 2 months to put in the claims. But I think the government probably urge you not to leave it to the very last minute, because it always leads to a bit of a backlog if claims are submitted late. So you can submit your claims as soon as you've completed the interventions. So if you've claimed before, then you could do 2 interventions this year and £500 would be available. And just to recap, if you've never claimed before, then there's an additional £250 you can claim. For the likes of CPD like this, that £250 is really for you to support your learning and development. It's a really straightforward form. So I've not filled in the forms, but all of the feedback we've had is that it's a very straightforward one to fill out. It's submitted through an online portal. You don't need to provide any details of expenditures. It's not associated with any on-farm inspections. There's no audits triggered, but you do need to have 1 form per intervention. And if you're claiming for 2 interventions in the 1 year, then they should both be submitted at the same time. But as you can see, it's a 1-pager. You'll fill in part of it, and your advisor, whether that be your vet or your consultant, would sign another part of it with their stamp, and that's all you need to claim. Okay, so let's just look at a wee bit more detail about why you might want to consider claiming the animal health and welfare interventions for roundworms. So for cattle and sheep, the options are to do gastrointestinal parasite roundworm investigations, and it expands that further as fecal egg count and wormer efficacy testing. And I know Izzy's going to go into more details about the practicalities of doing that, but we'll just talk about it a little bit more in general terms just now. So Celia had mentioned that some questions had come in already just about parasites. And say if we think about sheep, the textbook, say when I was at university, or if you look up old leaflets, it would suggest that there was a very seasonal traditional pattern to when different parasites occur. Perhaps with nematodirus, most common in the springtime. In the summer and autumn, different types of worms, maybe Telodisargia and Homunculus. And then as we progress into late autumn and winter, Trichostrongylus type worms. But really, the more we understand about parasites, the more we realise that the picture does not stay the same. And it's really important that we test, don't guess. So in recent years, we've been having, rather than nematodirus being limited just to the springtime, we've also been seeing cases of nematodirus worms later into the autumn time. Telodisargia we traditionally think of as being an issue perhaps in the summer or autumn time. But when we do more testing, we find that perhaps that type of worm can occur earlier on in the season as well. Homunculus, which is a blood-sucking worm, really can be seen at any time at all. So it's really important that we're testing to understand what worms we've got and what treatment is appropriate. And actually, often when testing is done, we might find that there is very little worm burden at all. And really the aim is only to use worming treatments, anthelmintic treatments, when we need to, because we don't want to overuse them. We don't want to use them when they're not necessary, because that could promote issues with resistance. But also the residues of these products in the environment, we want to use as little as needed, but as much as is needed, but as little as possible. So the mantra really, test, don't guess, is really the aim of the game, which is why this funding is available. So if you're doing a roundworm investigation, then an option would be to do fecal egg counts, or to do wormer efficacy testing, and to do wormer efficacy testing if it's found that your fecal egg counts are sufficiently high that treatment is needed. And using those results, you would work with your vet or advisor to determine what treatment is needed, but also think about how you can minimise the risk of buying in problems. So if you buy in animals, if they have resistant worms, then you should work with your vet to understand what biosecurity and treatments would be necessary to minimise the chance of those resistant worms getting into your herd or your flock. So if a fecal egg count has been done, And if it is determined that treatment is necessary, then we really want to know whether that treatment has worked or not, because it'll help inform you in future years whether that product is suitable to use in your herd or flock. And the timing of that second set of samples is really important. So very often, and I'm not sure if Izzy will go into this in more detail, but we can pick it up on questions if people are wanting clarity. In an ideal world, we would perhaps have individual fecal samples, say from 10 animals within a group. We'd perform a worm egg count on them. If those worm egg counts were sufficiently high, then treatment would be necessary. And then either a week if it was a levamisole product, or 2 weeks after any of the other products, we would take fecal samples from those same 10 individual animals again, so that we can see what the pre-treatment egg counts were. We can then check what the post-treatment egg counts are to see if there has been a sufficient reduction in the egg counts to suggest that that treatment has been effective. So the timings are really quite important there. Obviously, if you can do it individually, and if it's the same animals before and after, then that really increases our confidence that we have a clear understanding of whether that product is working or not. So just to give you some other pointers for if you're using worming treatments, sometimes when a wormer treatment doesn't seem to be effective, because we're worried about resistance, our mind might jump to thinking this has got to be a problem with resistance, but really we need to make sure before we use a treatment at all that certain other things are checked. So have the animals been weighed accurately? Are your weigh scales weighing correctly? Can you check that that is the case? If you're using a dosing gun, has that been calibrated correctly? Have you checked the label of the product that you're using? Is it meant to be given by an oral drench, or is it meant to be given by a pour-on or by an injection? Unfortunately, every year we hear of situations where a product is given by the wrong route, and obviously it won't be effective if that's the case, and it could even cause harm. We've had some cases where a pour-on product has accidentally been given orally, so problems can happen, and it's just really important that you always familiarise yourself with the products you're using and the labels, and ask your merchant if you've got any doubt. You also want to make sure the product you're using is in date. If it's been in the back of the shed for several years, then it might no longer be effective. Has it been stored correctly? So if you're using a product, be sure that you're using the right product at the right time by doing the testing to see if the treatment is necessary, and then make sure that the dosing is carried out correctly. And vets advisors can help you with that if you've got any questions. So we've had, we're increasingly getting samples to check post-drench efficacy checks, and it can really highlight some interesting results. So for example, we had pre and post-dosing samples from sheep where there was a flock where they were worried that they had resistance to macrocyclic lactones, so they are the group 3 wormers. And the pharmaceutical company supported further investigation to determine what types of worms were left after that dosing had been completed. So we knew that there were strong guile eggs, a particular type of worm egg that were left. But we could actually do larval culture to tell that there was only resistance in one type of worm that was left. And that's quite important, because if you've got resistance in one type of worm to a certain product, it doesn't necessarily mean that product is of no use all year round. It could be that product could still be effective for other types of worm, perhaps earlier or later in the season. So the more information you can get, the better. We tend to think of resistance or worry more about anthelmintic resistance in sheep, but the more we look for it in cattle, unfortunately, the more we find it is there as well. There's perhaps not been the same selection pressure on overuse of anthelmintics in cattle as there has been historically in sheep. But similarly, we've had pre and post dosing samples suspicious of, again, macrocyclic lactone resistance in cattle. In some samples that we received in recent years, these calves were actually in very good condition. They didn't have any evidence of diarrhea. So again, we were able to work with researchers to determine exactly what species of worm were resistant. And actually there were some Cuperia and some Ostertagia, so 2 different types of worm were remaining after the wormer treatment had been given. Okay, so that's the worm sort of side of things. This is, I hope everybody's had their tea. This is the abdomen of a sheep. Okay, so it's the just below the diaphragm. So this is the diaphragm, which is a sheet of muscle that separates the chest from the abdomen, and this is the diaphragm up in the top left corner here. And we've got an organ here just sitting behind the diaphragm that's actually the liver. Now, this liver is far from normal. So if you've ever eaten liver, you'll maybe remember that should be a much deeper red, deeper brown kind of colour, almost this colour, whereas this is much paler. And the other thing that's abnormal in this picture is that I'm seeing lots of sort of squiggly red lines through the liver. I'm seeing free blood just pooling in the abdomen and a great big blood clot here. And so this is a picture of a liver that's been damaged by immature liver fluke. The next picture we've got here is a section through a liver where it's chronic fluke. So it's damage to the liver from the adult stages of the liver fluke. These are the bile ducts here that are really, really thickened. The liver is again pale, but this time instead of being sort of soft, this when it was acute damage, this liver was so soft that you could poke a finger through it. And that's why the blood was there, because the liver had ruptured. Whereas with chronic cases, the liver can actually become firm. And that's because the liver is attempting to wall off these adult liver fluke that you can just see like little leaf-like structures just at the bottom here. So the adult liver fluke live in the bile ducts. They'll cause production loss. So immature stages could cause sudden death, whereas the chronic stages, the adult liver flukes, would be more likely to cause condition loss, perhaps anemia as well, but really loss in condition would be the main sign. So through the Preparing for Sustainable Farming animal health and welfare interventions, you can also claim money to investigate liver fluke in your flock or in your herd. Originally, they were only offering funding if you were going to be treating for liver fluke to check that the antibiotic product had been effective. But it was recognised that just understanding whether you have liver fluke in your herd or flock and whether treatment is necessary was really important. And so any type of liver fluke investigation is eligible for the funding through this scheme. So obviously those pictures I showed you were of a post-mortem examination, and if animals die, then we can examine their livers to understand whether there's a liver fluke burden there or not. But fortunately, there are other diagnostic tests we can do to determine whether there's a liver fluke burden there or not. And so this diagram that's available that was put together by both COWS, which is the Control of Worms Sustainably group, and the SCOPS group, the Sustainable Control of Parasites in Sheep group. This just sort of summarises the different sorts of testing that are available for liver fluke. So the x-axis line along here is showing time, and these are the ages of the fluke, really, the different tests can identify. So a post-mortem examination can identify really early stages of liver fluke when they're just within a week or two of them being ingested. The blood test for liver fluke antibodies can begin to pick up antibodies that show that animals have been exposed to liver fluke from a couple of weeks of age. Then there are two tests that can be done on fecal samples. So there's one called the coproantigen ELISA test. That's actually looking for elements that are secreted in the salivary gland of the liver flukes themselves. So that can pick up liver fluke infection from about 6 weeks post-infection. And if you're looking for liver fluke eggs in the dung, then it's really just an adult liver fluke infection that is picked up that way. That's because the liver fluke needs to mature to become an adult to pass out eggs for us to be able to detect the eggs in the feces. So dependent on what stage of infection animals are infected with liver fluke depends on what diagnostic tests are most appropriate. So they all have a place, but in the autumn time and into the winter, when we're traditionally worried about the immature stages, the early stages of the liver fluke, it's perhaps at Hopefully not post-mortem examination, because we'd rather understand that there was a burden before that stage. But the blood testing really comes into its own, because that can pick up liver fluke infection earlier than the fecal tests can. So if testing reveals, testing either through post-mortem examination or blood testing, or through either of the fecal testing, identifies that a fluke burden is there, then it's a minefield to consider what different types of products should be used, because there's loads of different products that have all got different trade names from each other, some of which will have the same active ingredients and some of them won't. Again, your merchants will be able to keep you right on whether the products are treating immature fluke or whether they're treating adult fluke. But just as a rough rule of thumb, triclobendazole, which is the active ingredient in products such as Fazanex, for example, that treats the early stages of liver fluke. Closantel and nitroxanil treat late immatures, and then the vast majority of products will treat adult stages as well. And so if you're looking at the data sheets of products that you're thinking about using, that will let you know which ones are appropriate. And this is a really nice guide that's available on the HDB website that also shows, for the different trade names, what active ingredients they contain and what stages of liver fluke they should treat. So if you're using a product, then you would want to make sure that if that product has been effective as well. And so for the Coprance and ELISA test, we'd recommend fecal sampling 2 weeks post-dosing in order to check whether that product has been effective or not. It's a little bit tricky, because if you're relying on the blood test to tell you that you've got a fluke burden, then it might not be possible at that time to check for efficacy. But if you're treating for chronic infection from the adult liver flukes, and you've got eggs, or you've got the Coprance and ELISA fecal test testing positive, then taking follow-up samples 2 weeks after dosing will be a good way to check that product that you've used has been effective. So just in summary, to do with liver fluke, cases of acute liver fluke, when you get the immature stages burrowing through the liver, making that liver so damaged that it could even rupture and cause a sudden death. In the past, we've had cases of them through the autumn and winter time. But in recent years, any diagnosis of acute liver fluke that we've been getting have tended to come later on in the year, if at all. We've had a pretty dry summer on the whole, and so it might be that the risk for liver fluke is lower this year. Saying that'll be very variable around the country, won't there? And if you've still got parts of your croft that are very boggy, then liver fluke could well be a risk, and could be a risk earlier. And so what's going on in the rest of the country is not really relevant. It's what's going on in your animals that's important, and that's why it's important that your animals are tested to help inform whether treatment is necessary. So the best diagnostic test to tell whether your animals have been exposed to liver fluke would be the blood test. And it's best that that's done on this year's lambs or this year's calves. The reason for that is that if you have adult animals that you test, they could be positive for antibodies to liver fluke, but that could be because they were exposed last autumn, and that's not representative of what's happened this autumn. So the blood test is really designed for being used on this year's calf or lamb crop. If you're getting sudden deaths, or if you're seeing that animals are pale, or if you're seeing that animals got a bottle jaw, these could well be signs of liver fluke, but don't just presume that it's due to liver fluke and treat them, because your diagnosis might be incorrect. In recent months, we've been seeing quite a few diagnoses of a worm I mentioned earlier called Homunculus, which is a blood-sucking worm. So that could also cause animals to be pale, to die suddenly, and to have a bottle jaw, a swelling under the jaw. The other thing that we sometimes see is that if there's been damage by using perhaps a dosing gun that's too big for the weight of animal that you're treating. Sometimes a dosing gun injury can present with very similar pictures as well. So I hope you don't, but if you do get deaths, then perhaps speaking to your vet to see if it's possible to get a post-mortem examination done, just to exactly understand what the what the reason for it is, rather than just presuming that it's got to be fluke because it's November time. It might not be, so a diagnosis will ensure that you get the correct treatment. Okay, I just wanted to mention lastly, rumen fluke. Sometimes we're getting a lot of questions about rumen fluke at the moment because we're increasingly seeing rumen fluke eggs being detected on fecal samples that are submitted to our laboratory for examination. I don't know if Izzy's found the same as well. This picture down the bottom here just shows adult rumen fluke. So this is the surface of the rumen, which is the biggest of the stomachs of cattle and sheep. And these adult rumen fluke are almost a sort of a centimetre in length. They're almost kind of like fat pomegranate seeds. But almost always we consider the presence of adult rumen fluke to be an incidental finding. They just sit there, they don't particularly do much harm, but they will pass out eggs in you can be picked up in our fecal samples, can be detected in the fecal samples. We're able to distinguish between liver fluke eggs and rumen fluke eggs because rumen fluke eggs are clear in appearance, whereas liver fluke eggs are more golden. So they're usually nothing to worry about, but in very, very rare circumstances, literally about 4 or 5 cases in Scotland in the past sort of 15 years, we've found that a high burden of immature rumen fluke can cause a severe scour and dehydration. And so this is a picture of a section of intestine from a sheep that had a massive immature rumen fluke burden that really trashed the intestine and caused a very, very serious diarrhea. So it's only very rarely that we would consider that treatment for rumen fluke specifically was necessary, and most often treatment for adult rumen fluke is not considered needed. I just wanted to summarise, just to remind you that through the Preparing for Sustainable Farming grants, there's up to £750 available for you to claim this year. And your vets and consultants are really well placed to help you decide which options are the most appropriate for your flock or for your herd. And I just wanted to signpost you to a couple of other really good resources. So the SCOPS website has got loads of really useful information, as does the COWS website to focus on parasites in sheep and cattle respectively.
What's the rule of thumb for preparing animals for overwintering with regard to worming/fluke treatment?
Yeah, so I think the rule of thumb would be to do some testing. So don't just guess. Don't go by the calendar that it's November, therefore I give them a fluke dose. We really need to move away from just treating regardless and really think about testing to see whether treatment is necessary. So for say for sheep, then getting blood samples from lambs to tell whether they've been exposed to liver fluke is a really good idea, because none of the fluticide products have any persistent effect. And so if you go in and treat for liver fluke too early, then it's a waste. The product isn't going to do anything at all, and in fact using it when it's not needed could cause an issue with resistance. And so speaking to your vet about maybe getting blood sampling done to check whether treatment for fluke is needed. Some people have started doing that already. If the results are negative, then you could test a month later and a month after that. There's a blood test that can be submitted to laboratories. There's also now a Parasites test available that, again, your vet would be able to talk to you about. So this is like a little lateral flow device that farmers are able to do themselves to check whether there's been exposure. So I hope that helps for the fluke side of things. For the wormer side of things, I guess we'll talk about lambs again. For lambs, if really monitoring growth rates and condition and looking for any signs of diarrhea is a really, really good start. And then thinking about submitting fecal samples, or as he'll tell you how you can do them yourselves, to check what the worm egg counts are, and only treating if there's clinical disease and or there's a strong guideline count above a certain threshold. So yeah, I suppose, Kathleen, you might think that I'm not answering your question because I think the point that I want to get across is there's not a one size fits all approach to parasite control. You really need to consider the risks in your croft. If you're using the same land over year on year for young stock, for example, then parasitic burden could build up. Saying that if you've got a more extensive grazing management system, then it might be that parasitic burdens don't get so high that treatment is needed. So I think it's really best to speak to your vet about getting some testing done and then making your decisions from there.
Asking what is a group 3 wormer, and
Yeah,
can you tell us more about blood testing lambs, and are there kits for blood
yeah,
testing lambs?
certainly, yeah, yeah. So, the broad families that the wormers are divided into are split into kind of five groups, really. So, group one are the white drenches, group two are the yellow drenches, group three are the clear drenches, and group three are products that contain ivermectin type products. And so the reason I mention that is because when we're checking for efficacy, if a wormer, say from a group 3 class of drugs, is found not to work, then any of the products that are a group 3 wormer that have got an ivermectin as that active ingredient are unlikely to be working for that type of worm. And so yeah, that I hope that makes sense, that even if there's a different brand name, a different trade name, if the active ingredient is an ivermectin or a group 3 type wormer, then you would expect there to be resistance across any of the different trade names that have got that same active ingredient. But your merchants that you buy the products from will be able to help advise you on which groups each of the different wormers are from, or that HDB guide as well. For the blood testing for lambs, so that was the blood test for liver fluke antibodies. Yep, blood samples can be taken by a vet and sent off to a laboratory, or there are these lateral flow kits that are now available. You'd have to buy these lateral flow kits from your vet. So yeah, you would discuss that with them, but they're made by Norbrook.
Asking, after worming, is it best to move sheep onto clean ground or keep on existing ground for day?
Really good question, Olga. So you're probably better to retain the animals on the dirty ground, because if you move them onto clean ground, then if there are any resistant worms left over, then it's only resistant worms that would go onto that clean pasture. Therefore, there would only be resistant worms there. And so what we're hoping to do, if there is resistance, is that they would be diluted. And so it's better to not move them onto clean ground straight away, to keep them on the existing ground for a few days.
Very interesting. Okay. Philippa is asking, is there a minimum number of lambs you have to take blood from?
Yeah, absolutely. So the suggestion would be 10 per management group, or all of them. If you're a small croft and you have, four lambs, then it would be a case of testing all of them. Yeah, so that would be the recommendation.
Okay. Chris is asking, is it recommended to change what kind of drench you use regularly to stop the sheep developing resistance to it?
Yes, I think that's probably a fair consideration. But we want to minimize the amount of drenches that we're using at all. And so we would want to test to check that a treatment is needed. The testing would help determine what treatment would be indicated. And then it would be good to use one group of wormer and then take follow-up samples to check that one has worked. But yeah, later on in the season to use a different group of wormer. Best speak to your vet though, because the sort of group 4 and group 5 wormers, you probably want to keep them in reserve for when they're needed. But as a general principle, not to use the same one over and over and over again. several times in the year and in repeated years is a good idea to rotate them. Yeah.
Okay, good. Neil asks, how long would you need to keep sheep off ground to keep from reinfecting?
So I guess what we think of with parasite control is the relative risk of different pastures. If you've got young animals grazing land, that would be considered very high risk pastures. Whereas if you've got newly sown grass, then that would be considered clean pasture. Um, so it's relative risk as opposed to absolute certainty that there would be no parasites, but you can anticipate that if there'd been lambs on or calves on ground that season, that's the highest risk. If they were there the previous season, then that's the sort of medium risk, and if it was new grass, that would be the lowest risk.
So how long do you need to leave a field empty of livestock before it becomes parasite free, and do parasites transfer from one species to another?
Yeah. So we wouldn't really consider it parasite free unless it was, ploughed up and new grass, new ground, new lays put down. Um, as far as the parasites from one species to another, liver fluke, it's certainly the same species of liver fluke that infects both cattle and sheep. But other than that, the worms are mostly distinct from each other. But there can be cases where, like homunculus, for example, could be in calves. Homunculus, which is predominantly a sheep parasite, could be in cattle. But most of the gut worms are different from each other, but liver fluke is the same.
What happens if it's common grazing that's the infected ground?
So I guess what you need to do is work with everybody who's using that grazing and to consider the parasite control plan, the monitoring for that whole group together and work together to determine what treatment is necessary, and yeah, work together to do the testing together as well. Yeah.
If lambs start to show symptoms while in winter housing, how do you prevent reinfecting with limited shed space?
Yeah. So treating while they're housed is quite good, because it means that that they won't eggs shed inside won't really complete their life cycle. On the whole, they won't really complete their life cycle. There can be some um, you can get problems with some species of worm inside strongyloides, but on the whole, if you treat them and if you're keeping the sheds clean and disinfected and well bedded, then the opportunity for worm burdens to to carry on in housing is completely limited.
If bought-in sheep were treated with Zolvix and kept in a shed, how long should they stay in the shed before it's safe to let out with the rest of the flock? How long does it take for treatment to work?
Yeah. So we could, after the Zolvix treatment, you could take fecal samples 2 weeks post-dosing to check if there were eggs there or not. And hopefully if the treatment has been effective and there are no worm eggs there, then they would be good to go out with the rest of the flock. So you'd really want to check that treatment had been effective before you allowed them to mix with the rest of the flock.
Would liming help the infected croft?
I am not aware that it would be effective. So yeah, I might be missing some evidence there, but it wouldn't be considered a common practice to do that. I don't think, and so I think yeah, testing and treating as necessary and checking that the treatments have been effective would be important.
Hi, everybody. Yeah, my name's Izzy and I'm a crofter in Lewes, but my background is veterinary nursing. I don't work in practice at the moment, but I still keep my registration up to date. And one of the things that I decided to start offering, because it was something I used to do a lot of in practice, and as I guess most of you will know, crofters have many little streams of income. I decided to offer fecal worm egg counts for crofters and for horse owners. Predominantly, I used to work in equine practice, so I do a lot of horse worm egg counts, but the technique for doing cattle and sheep, the technique is the same. And yeah, I just sort of felt there was a need as well, a need for education, for people to understand the importance of it, and then obviously to be able to offer that service. Hello, my name's Izzy DeSantis, and my background is working as a registered veterinary nurse. I'm no longer employed in practice now. I'm here on the Isle of Lewis, but I do carry out fecal worm egg counts for crofters and horse owners in the area, which was something that was part of my job when I was working in practice. So today I'm going to demonstrate how to go about that and show you what it is that I do and answer any questions.
Great.
The reason I've been asked to do this talk is because there may be some of you who would be interested in actually doing your own worm egg counts for your animals at home. It's something that can be done at home with a little bit of investment and a little bit of knowledge. So I'm going to show you the equipment that you need and the equipment that I use, and after that I will show you how to go about preparing and examining a sample.
Two.
So the most important piece of equipment for doing this is a microscope, and microscopes vary in price, in type. You can have one that's a binocular microscope with 2 eyepieces or a singular one. I've gone for the binocular one because that's the one I'm used to using, and I've also got this particular one because I can use it for looking at other samples if necessary. However, the important thing for fecal worm egg counts is you are going to need a microscope that's got the 10 times objective on it, which generally microscopes will have that, but that is the objective you'll be using for looking for worm eggs. The other important piece of equipment you need for worm egg counts is your slide, and you use a specific slide called a McMaster slide, which is maybe difficult to see on film, but it's got 2 chambers, and each chamber is marked out in a grid. And when you actually have your sample under the microscope, you're going to be just counting the worm eggs that appear in each of the grids. So the rest of the slide, you would actually ignore anything in that, and you'll be looking at the grid in each chamber. You also need a few other bits of equipment. These are the cheaper bits of equipment. So you're going to need a 50ml syringe, which is, or up to, it can be bigger than 50 mils, but like the kind of dosing syringe that you've probably used for dosing animals. You are also going to need a small pipette, and these are the sort of things that you can easily buy online, places like Amazon, eBay, any other sort of online retailer. They're very easy to come across. The other equipment that you need is generally things that you could just find in the kitchen. So for example, I actually use 2 mugs for preparing my samples. I have a fork which I use to mix the sample, and I have a tea strainer for straining the sample. It's just important not to get it mixed up with the one you use for straining your tea. The other thing I find really useful, because I do quite a lot of these, is I just have a little counter. So if a sample has a lot of eggs in it, I can click the counter to keep a record of them without having to hold it in my head. Finally, when we prepare the sample, you need to use saturated salt solution. Now, you can just use regular table salt, it's fine, but you're going to need something to put that in. And so I've got a jug here. You can tell it's saturated because not all the salt has dissolved and it's actually sunk to the bottom. So they are the basic things you need for your samples. And then The other thing is identifying what you find. Now, with practice, you will get to learn what it is you can see. But I have a particularly good book. There are a number of reference books. This is just the one that I used to use in practice. It goes into a lot of detail and a lot of depth, and you don't necessarily need all that detail and depth. But it's really helpful if there's something on the slide that you're unsure of. You can use this guide or something similar to identify what it is. So for each sample that you're going to look at, you first of all need to collect your fecal sample. The best thing to do is to have fresh feces, fresh droppings from the animal, and if at all possible, to take a bit of a sample from more than one pile of feces. So for example, if you were doing a horse, you would try and get a sample from maybe 3 piles of droppings. Ultimately, you only actually need 3 grams of feces in the end. But getting a sample from various drop piles. So the advice is that if you were doing a sample for a horse, you would do a sample for each individual horse. However, if you're doing samples for cattle or sheep, the advice is that you would do 1 sample per 10 animals. So if you had a flock of 20 sheep, that would be 2 samples, or a flock of 15, that would also be 2 samples, just to try and give you a broad overview of whether the flock are carrying any parasites. So I have my 3 grams of droppings, and the next thing is to add 42 millilitres of your saturated salt solution. Once you've added that, you need to mix it well and kind of mash the droppings so that they're as well mixed and disintegrated as possible within that solution. And then once you've done that, you're going to transfer the solution through the strainer into another container. And what happens is any parasite eggs will actually float to the top of your salt solution. So once that's strained, before it has time to settle, you're going to collect a sample with your pipette and then fill both sides of your McMaster chamber. And you ideally want to try not to have any air bubbles in it, because the air bubbles will just get in the way when you look through the microscope. Once you've got that, leave it to settle for a few minutes so that the eggs are not all floating around and they make it easier to see. And then once it's settled, which will assume that I have left this for a few minutes, you're going to place it onto the microscope, switch it on, and make sure you've got the 10 times objective. And then you then proceed to systematically follow the microscope, the grid from left to right and up and down. And as you're doing that, you are looking for any eggs. And if you see an egg, just take a note of it. And then once I've gone through the whole slide, I'm going to actually add what I've seen in one chamber to what I've seen in the other chamber. So for example, if there were 2 eggs in one chamber and 3 eggs in another chamber, that would equal 5 eggs, which is the equivalent of 500 eggs per gram of feces. And then you're going to divide that by 2. for your result, and the result would be 250 eggs per gram. So in effect, one egg equals 50 eggs per gram of feces. And then depending on your previous worming history, it would depend on at what level you decided to treat. So for example, this horse that's got a worm egg count of 250 grams, I would advise treatment. As I'm not a vet or a suitably qualified person, at this point I'd refer the client to the vet or to a shop that sells wormers and ask them to get their advice. So I'm happy now to take any questions. If anybody's got any questions on the procedure or the equipment that's needed, then please feel free to ask. And just this final image, because it seems very relevant, is a picture of a liver fluke egg, which is one of the predominant and most damaging parasites that we have to deal with here on the island.
What is the starting cost of a microscope?
From, I suppose, probably, I couldn't say exactly, but relatively cheap. Sort of, I guess, £50-ish. I don't really know what the quality would be like. I think the one I bought was around the £200 mark, and I wanted to get one that I could use for other, for looking at other specimens as well and things like that. So yeah, but actually surprisingly cheap.
Is that something that you can get covered by PSF funding, would be the purchase of a microscope? Helen, do you know that?
I don't think it's specifically for that, because the form is being signed to say, let's just check the wording of it. It's to implement the sustainable prevention and control, including biosecurity and advice and things like that. So I don't think it is really saying that if you do these interventions, you get £250. So what you choose to spend that money on is up to you. So I suppose indirectly you could, but it's not like you could put in your receipt for the microscope and claim the money. In order to claim the money, you need to do some testing and get some advice and act on it. But it's a nice way to look at it, isn't it? That if you get that money, then what you could invest that money in.
How long should it be from taking the sample to testing it?
It should be as fresh as possible, but I'm not saying that you have to take a sample and run straight in with it. The ones that I usually advise, the ones that I collect from the local, from the Crofter's store, I ask them to be there sort of within 24 hours. You could keep them longer if you put them in a fridge, because it's the warmth will make the eggs hatch, or potentially make any eggs hatch, which makes recording more difficult. But if you want to collect samples and keep them in a fridge, then you can keep them for longer than that.
The other thing, just to add on that, is that it's recommended that if you're going to be sending samples somewhere, that you fill the pot right up, or if you're submitting samples in bag, to squeeze the air out, because again, that minimises the amount of hatching that goes on. And if hatching happens, then you could have a falsely lower egg count than the sample would have had to begin with.
What factors are relevant when considering treatment when egg count is medium?
I think it depends. I mean, I know various parasites, they will advise sort of various thresholds. So it wouldn't be a standard, egg count of, for example, 300 eggs per gram means treatment. It would depend on what parasite. So I think it's looking at what the threshold is for that particular parasite. So, for example, liver fluke, they do advise that just the presence of one liver fluke egg in a sample would suggest treatment is needed, whereas strong isles for horses, you can have anything between sort of 250 and sort of 400. But the other things to consider as well are things like the age of the animal, if there are any clinical signs as well. So it would depend whether you were testing, I suppose, simply to see if treatment was needed at that point in time, or if you actually had more concerns. You just, I mean, I did a sample for some cattle recently, and they had cocci, but it wasn't particularly high. However, I sort of advised that if they were young cattle or there were clinical signs, then they needed to speak to the vet about it.
And the other things to think about is how are the animals doing? You know, if they're young animals, are there weight gains as you would expect? Is there any signs of clinical disease? Adult animals, we tend to expect they should be able to cope with worm burdens on the whole. Not for fluke, they wouldn't build up any immunity to fluke, but very often when you get high worm counts in adult animals, it could be that something else has gone wrong, perhaps. So there could be other underlying clinical disease. So if you have sheep or cattle with, say, Johne's disease or OPA or bad teeth or poor nutrition, then they might have higher worm burden. So if you've got an individual sick animal that's got a high worm burden, that's not necessarily representative. In fact, it's very likely to be unrepresentative of the rest of the group. So just bear that in mind as well.
From your experience, are there particular times of the year you find worm eggs or fluke eggs?
To be honest, I have only been doing this sort of consistently since February here in Lewis. And then before that, I was mostly doing horses. So horseworm eggs could be found generally any type of time of the year. The fluke eggs, I would anticipate that it would depend on, to an extent, it would depend on the time of the year because of whether, you know, they were immature or not. But in this sort of relatively short space of time, I haven't had a particular pattern at all. I found some a lot of fluke because I know that is sort of a big problem here, and others have just varied. So I'm sorry, that's not really a very helpful answer, but that's just a reflection of what I've observed.
We get most samples through summer and autumn, you know, for worm egg counts, really thinking about sampling lambs and whether treatment in lambs is indicated. And different parasites will tend to be at different times of the year. So really there could be parasitic burdens at any time of year. You might get more nematodirus in the springtime. You might get other parasites later on. But the parasite, we're increasingly understanding that the parasites do not read the books, so there's not necessarily just one time of year. As far as the fluke goes, yeah, traditionally would expect them to begin to acquire fluke from the sort of autumn onwards. But last year that was pushed much later. We're getting cases of immature fluke right into sort of February and March. Therefore, there wouldn't be eggs detected in those animals that were infected for the first time for another couple of months after that. So I think there aren't really any hard and fast rules, and that's why testing of your animals on your farm or your croft is so important.
Is fluke a particular problem in Lewis just because of the weather and the ground conditions? Is that?
Yeah, I think it's we have a lot of wet ground, and I suppose it's perhaps I would imagine similar in other Hebridean islands or any area where apart from the wet, they have the sort of traditional lazy beds as well, where a lot of animals are now grazing on croftland that used to be lazy beds. So there's a lot of sort of drainage ditches and reedy areas. So I'm assuming that is why it's such a big problem. But certainly working on the mainland in the North Pennines, it's we didn't see it like I see it here.
A snail that's an intermediate host, and so the snails need standing water. So that's the critical bit of the life cycle.
Mm-hmm.
Saying that, areas where, like say in Argyll, where they've always got problems with liver fluke. A couple of years ago, a lot of farms in Argyll did serology just to check when to optimize the treatment, or when treatment was necessary. And a lot of farms there would have routinely been going in October, November, December time, whereas serology was suggesting that this is a couple of years ago, and that's not to say this year will be the same, but many of the farms, they weren't seropositive until January or February, and so it was much later than anticipated.
What scales do you use to accurately weigh 3 grams of feces?
You can use, well, they have, I don't know what you would call them, but there are scales that are designed to just weigh out small amounts. We always used to laugh about them as if we used to call them the drug dealers scales. But so yeah, weigh out small amounts. But to be honest, you can sort of estimate it as well. And an easy way of estimating it is to get something like a 5 ml syringe and cut it off at 3 mils and then kind of stuff it full. And that's approximately 3 grams as well. And the thing is, it's one of those tests that is, you want it to be as accurate as possible with your measurements, but I think it's also something, bearing in mind that it's never going to be totally accurate because it is only a sort of a small sample of something, and so it always has the potential to actually have more or less eggs in that particular pile of droppings anyway, which is the reason we go to, we try and get from 2 or 3 different piles just to try and reduce that.
SRUC gives thresholds when treatment is advised. Are the SRUC guidelines regarding EPG, I don't know what that is, also applicable for lambs?
Yeah, eggs per gram. Certainly when we get fecal samples submitted to us and we report out, we have got guidelines, and so it would suggest that as a general rule, less than 250 eggs per gram treatment might not be warranted. Say 250 to 70 is a medium burden, and it's best to take all the other factors that we discussed earlier, and over 750 is considered to be a high burden. But it's really best to discuss these in conjunction with an understanding of the clinical history and the growth rates and the clinical signs with your vet or advisor.
Can deer coming on to grazing ground introduce worms?
Yes, some of the like the internal parasites are not species specific. So ruminants can carry the same parasite. It's a lot more likely to have species specific ectoparasites. So things like fleas and that sort of thing are more species specific. But so I would assume therefore that yes, deer can do that.
Absolutely, yeah. So liver fluke would be the same, and some worms will go between them, others won't. But there's definitely a risk there.
We have always had bother with fluke back and forth, but we have a lot of wet ground around the loch in Shetland. What would be the best way to prevent infection?
Is it possible to fence off any of the worst areas? Sometimes people look at you like you've got 2 heads when you say that, but if there are certain parts that are really, really bad, then maybe fencing them off. And I guess thinking about if you've got different groups of animals, which ones are most at risk? Can you, whilst liver fluke will infect both cattle and sheep, the cattle aren't susceptible to acute disease from liver fluke as a general rule. Their livers are sort of tougher and harder, and so whereas putting sheep onto very heavily infected ground, they are at risk of a sudden death from immature liver fluke. So putting your sort of it depends if you've got a mix of grazing that you can mix of animals that you can use. I guess just thinking as well about if you've got lambs that you're wanting to get away, say without treating, then can you keep them off? Can you put them on the best land that you've got? The other thing that can be helpful is to if adult ewes, say in the springtime, are infected with adult fluke, because you're seeing fluke eggs, then giving a product that clears them out of adult liver fluke can minimise the amount of onward pasture contamination to allow the liver fluke cycle to carry on. So there's a few different strategies, but you're probably best to speak about it kind of holistically with your vet, I would think. But number one thing, if there's really bad areas, if you can fence them off, that would be a great help.
To be honest, I was going to say the same thing about fencing it off, and from things that I've noticed from samples that I've looked at from crofters that I know they're grazing, I have noticed the ones that I know have got really sort of quite dry hill grazing at that point have definitely shown less or no liver fluke compared with those that I know are grazing in pretty boggy fields.
I suspect that class 1 wormer is not working properly. EPG is still 50 to 100 after 2 weeks. What strategy would you recommend? From
my point of view, if that was the worm egg count that I'd got back, I would actually be saying, if they had no other concerns apart from the number, I wouldn't be advising that they needed to treat anyway. And if they did have concerns, then I would be advising them to speak to the vet. But that's just from the point of me being the person who's given them that result.
Yeah. And I guess other things to think about, there's a few too many unknowns just in that question. So what I don't know is if there was a pre-dosing check done, so there could have been 10,000 eggs per gram before treatment down to 100 gram. That would be very different from if it was 150 eggs per gram down to 100 eggs per gram. So what the percentage reduction is quite important. And the other thing just to check through would be that the animal was weighed and dosed according to the weight, that the dosing gun was calibrated, that the product was in date stored correctly, all of these sorts of basics. If there's a suspicion of lack of efficacy though, that should also be reported, and so you should be discussing that with who, whether it was a merchant that sold that to you or the vet that sold you that product, because there's an obligation for us to report suspected lack of efficacy. So whilst Izzy's right, there might not be a requirement to go on and treat with something else if the animals are well. It would be good to investigate further just to know whether there's a resistance problem or whether it's been an administration problem that has led to that. So it might be that some follow-up, further follow-up testing might well be of benefit. It might be as well that there's resistance, say, just in one type of worm, and so that class 1 wormer may still be effective against nematodes, for example. So I think speak to your vet or your suitable qualified person who's sold you the anthelmintics just to discuss that through. But there's a few different areas that you could explore.
What about fluke and rabbits? And there's actually a follow-up. Chris is also asking about geese. So I guess is it the same as with deer?
Geese, I would suspect it's they're carrying different parasites. And one thing which is, I don't know how true it is or not, but I have heard older crofters say that, well, they don't like the geese because they eat the grass, but they do like the geese because they eat the snails. How true that is, I don't know.
I've heard a similar thing with the geese. So the geese can be a real challenge, and I know they will absolutely strip the grass. But I'm not aware of geese transmitting parasites that would be infecting cattle and sheep. There's a small possibility that there might be some bacteria and things, but most bacteria are very host specific, so there wouldn't be too much of an issue there. Rabbits, I'm not 100% sure. I'm afraid I'm not a small animal vet at all. It's such a long time since I've done them, but it's not ringing a bell with me that rabbits get liver fluke, but horses certainly get liver fluke, don't they?
Yeah, but not it doesn't seem to be such a big issue for horses. I don't know if they're a bit like cattle. I haven't done so many horse samples here. I certainly didn't used to see it on the mainland, but here I haven't seen it yet.
Yeah.
But I suppose rabbits and horses have their similar sort of
that was
digestives, don't they?
that was my train of
Yeah.
thought. I'm not aware of rabbits being a risk. Outing myself because people can get infected with liver fluke, can't they? There have been cases of people eating watercress. That's the thing, isn't it? And so they might well be part of the part of the story. But I guess you're not going to be able to treat them, or we wouldn't be advocating treating them. And so I suppose in terms of testing your own animals to decide whether treatment, that sort of mantra still stays true.
Does treatment for worms or fluke have negative side effects for the animal being treated?
On the whole, I would say no. But some of the wormers have a narrower safety margin than others. And so we're usually worried about underdosing, because if you underdose for the weight of animal, that could predispose to resistance. But on some, with some products, if you go, say, double the dose, then that can be really, really dangerous. So like closantel toxicity, if you give too much closantel, animals can go blind, and it can cause brain damage. So if they're used at the right concentrations, then the side effects would be minimal, if any. But overdosing, could be an issue. So that's why it's important to follow the data sheet recommendations.
Can eating certain plants help reduce worm burdens? And a follow-up question, Martin has heard that bird's foot trefoil can do so, but would like to know if that's true.
Yeah, I think that's to do with the tannins in certain plants. I think there's sort of bioactive forages and chicories and things like that. I think there is some research that certain plants can make them less hospitable for worm species. So yeah, there is a bit of truth in that, but there's probably a lot more research is being done on that area.
I think just maybe it's a bit anecdotal really, but we have a flock of Soay sheep and they very, very rarely need treating for anything. They're a sort of a primitive breed and they are very hardy and they are browsers. So they don't just, they like to browse. And I wonder if, anecdotally that might have something to do with one of the reasons they don't need as much treatment, perhaps because they are browsing on different plants. But that's an anecdote. That's nothing scientific.
Yeah. Just found that some colleagues had put together some work on this. So bioactive forages include the bird's foot trefoil that you're talking about, sainfoin and chicory, and they can reduce the negative effects of parasitism by decreasing the amount of eggs put out by the worms, and decreasing the development of eggs into larvae, and is decreasing the amount of larval development. So yeah, there is something in it, but yeah, probably more work to be done on it.
What are your thoughts on giving mineral and vitamin drench at the same time as treating for worm and fluke?
Yeah, so I think it comes down to whether they need it as well, doesn't it? Again, I'm afraid I'm like a broken record. I think testing to see if there are deficiencies. So as far as the sort of trace elements go, copper, cobalt, and selenium would be the ones that often people will test for. If there is a cobalt deficiency, then that could make animals more cobalt deficiency and parasitic burden can kind of go hand in hand. And so if they are deficient, then giving that at the same time might be a good idea, but it's not a good idea to mix them in the same syringe or in the same dosing gun. I think there's maybe 1 or 2 products that have got trace elements along combined with a wormer that it's you know, the product is made that way, but you shouldn't do any sort of home mixes like that.
Sheep who have range, would they be less likely to need worming fluke interventions, i.e. moor and hill?
So I guess if they're more extensively grazing, then the opportunity for parasites to build up might be less. However, they might be on poorer quality pasture, and so their protein intakes might be lower, and so that might reduce their ability to cope with parasitic burden. So there can be a bit of a trade-off between those two things, to be honest.
Not treating 10% of the flock or animals in best condition, is that good practice?
Yeah, so this comes down to that if there's a problem with resistance, we want to make sure that it's not only the resistant parasites that are left. And so if a group is being treated, then leaving some untreated is a good idea. But in many flocks, it could be more than that are left untreated. And in an ideal world, we'd be doing what we call targeted selective treatment. So dosing based on egg counts, as we talked about, or weight gains. And so it might be that if you did your treatment on that basis, that actually 10% required being treated as opposed to 90% and 10% untreated. But yeah, the more animals we can leave untreated, the better, as long as that's not to the detriment of their health.
Izzy can maybe speak to this. We are high in copper on Lewis.
It's a really good point, because if you supplement, I guess that's what I was trying to get at with the giving the mineral or vitamin drench at the same time as a wormer. If you've got enough copper and you give too much, then you can have animals dying of copper toxicity. But is it a lot of brewer's grains? Is that why you're maybe high in copper in Lewis? Is he? Brewer's grains being fed?
I don't know, to be honest. Oh, it says they're geological. I mean, we tend to let our sheep and cattle just, they have a mineral lick, and so it's kind of quite ad hoc. But yeah, no, I didn't know that about the copper.
And some breeds are more tolerant to copper than others, you know, so it's certainly one you want to make sure that you don't give too much of if they don't need it.
I think that's everything. Thank you so much, Helen. Thank you, Izzy. And thanks everyone for coming. That's smashing. And we'll keep checking our website to see what else is coming up in terms of training.